Lots of people who take prednisone have to take calcium too, but calcium can interact with a lot of drugs. One of the drugs that calcium can interact with is thyroid medicine. And the most common thyroid medicine, in fact, the second most common drug in the United States is levothyroxine. Levothyroxine is, this is your thyroid right here, and it produces two hormones mostly, the T3, which is liothyronine, and T4, which is levothyroxine. And so when people have thyroid problems, they take a pill that contains thyroid medication. And that way, they have this hormone to replace what they normally have. It's a lot like how we have prednisone that replaces our body's cortisol. So if you have to take prednisone, then you should be taking calcium as well to help boost your bones, to counteract the glucocorticoid-induced osteoporosis, which is a permanent, irreversible side effect. The bone loss from prednisone is irreversible. And so the doctors who prescribe prednisone the most say you should be taking calcium. But what if you also have to take levothyroxine? What should you do? Can you even take calcium with levothyroxine? Because this is a drug interaction. So I'm Dr. Megan, the prednisone pharmacist. And what the studies show is that if you were to take your levothyroxine pill along with a pill of calcium together in one swallow, the dose of your levothyroxine that is absorbed is blocked by about 20 to 25%. So if you're normally on a typical dose, let's just say you're on 100 micrograms of levothyroxine, then, and you take it along with calcium, or you eat a calcium-rich food, we'll get back to that in a second, what happens? So if you take them together, you normally would be getting 100 micrograms, but now you're only getting 80 or 75 micrograms. You're way lower in a dose than you would have otherwise been. What if you've always been doing it this way? What if you always take your thyroid medicine with a big swig of milk that's high in calcium? Then just keep doing that because your body is used to that. But if you are new to calcium, if you are new to prednisone, if you are new to levothyroxine, let's get you started the right way. So what should you do? Because we now know you probably shouldn't swallow the levothyroxine, prednisone, and calcium all at once. That's probably not a good idea. What can you do instead? So levothyroxine should be taken without food, and it should be taken first thing in the morning. So that means you should take it, say, at 6 a.m., whenever you wake up, with a tall glass of water. Take that levothyroxine first thing, and then half an hour later, you could take the prednisone, and then you wouldn't want to eat a high calcium meal or take a calcium supplement for at least 3 hours, if not 4 hours later. So say it's 6 a.m. when you take that levothyroxine, so you'd want to wait until at least 9 or 10 to take calcium supplement. And you should be taking a calcium supplement because you want to protect your bones. So that's how I recommend doing it. Levothyroxine 6 a.m., prednisone 7 a.m., or it's possible you can take them at the same time. You could take both prednisone and levothyroxine at 6 a.m. And then you'd wait until 9 or 10 for your calcium supplement. Now, everything I say is definitely important to run past your doctor. I'm not your doctor, so get your best advice from your doctor in your specific situation. But it's a question I get often, and I wanted to make sure that I made a video about it so you could understand that you need to separate the calcium and the levothyroxine by at least 3 or 4 hours. So what kind of calcium should you take if you are on prednisone? Well, I was dealing with that question myself because I had to take prednisone for a bleeding disorder. It saved my life, but I was like, shoot, I know osteoporosis runs in my family. I don't want anything to do with that. I never want to have the hunched over back, lose height like my grandma's did. I don't want to break my hip. These are not things I want. And so I invented a supplement. It's called Nutranize Zone. And I have a bedtime bottle and a morning bottle. They come shrink wrapped together like this. So people often ask me, can I take prednisone and levothyroxine and Nutranize? And I say, yes, just not all at the same time, not all in the same swallow. You'd want to take the morning bottle of Nutranize. There's 2 pills in each of these that you take each day. So you take 2 in the morning and 2 at bedtime. But if you're on levothyroxine, you would want to do your levothyroxine first thing, 6 a.m., and you could take your prednisone with it. And then 3 or 4 hours later at like 9 or 10 a.m., you could take the morning bottle of Nutranize because it has calcium in it. And then it also has other ingredients to help the calcium get into the bones where you need it. And that way you can feel better while on prednisone, and you can be making sure you're allowing your levothyroxine dose to get into your body so that your thyroid is supported properly while you're taking prednisone and levothyroxine and calcium. Hope this answered your question. If you have any other questions, let me know below. Otherwise, I encourage you to get Nutranize at nutranize.com. Signing off as Dr. Megan, your prednisone pharmacist.